Good morning, everyone. Welcome to our weekly media briefing for COVID-19 here in Shasta County. I'm Carrie Schutte, the Public Information Officer for the Shasta County Health and Human Services Agency. I'll start with our daily numbers. And in Shasta County, we have 118 total confirmed cases. That's unique individual people, including 6 confirmed cases from yesterday. We've done 12,475 tests. We have 20 people in isolation, 169 on quarantine. Right now, we have 9 people who are hospitalized, including 8 Shasta County residents and 1 person who does not live here in Shasta County, along with, and of those 9, 2 of them are in the intensive care unit right now. I will do a round of introductions and then we'll open it up for our presenters to share anything new that they might have, and then we'll move on to media questions. First, we've got Mark Mitchelson from Shasta Regional Medical Center, Valerie Lakey from Mayor's Memorial Hospital District, and the folks from Mercy are not able to be here with us today. From Shasta County, we have Donnell Ewert. He is the director of the Shasta County Health and Human Services Agency. Matt Pontes, who's the CEO of Shasta County. And today I'm standing in for Dr. Karen Ramstrom. We have Dr. Michael Vivakis, who is our deputy health officer for this incident. So thank you for joining us, Dr. Vivakis. We are ready to for any presentations that anybody might have, any information that you all would like to share with us today.
Hi, Carrie. So for Shasta Regional, we just wanted to tell the community that because of the recent increase in cases and potential quarantine isolation cases in the county, we've decided to temporarily go back to having no visitors within our facility. Of course, there's those exceptions, such as in life, or if the person cognitively needs to have a person with them. But just because of the uptick, we wanted to make sure our patients are safe and our staff are safe. And so we think just for a short time, we'll have no visitors at the facility for right now.
All right, thanks, Mark. Anybody else?
Morning, Carrie. I just wanted to say a few things about our current situation. Obviously, our numbers have increased significantly during June from where we were at the end of May. So we definitely have seen an increase, and that was not unexpected given the opening of many businesses. Interestingly, and I think this has probably been widely reported already, what we've really seen is a lot of cases associated with travel, either folks traveling out of the area and coming back infected, or individuals visiting people here, staying with them who were infected somewhere else and came here. In addition, the family gatherings or other small gatherings have been a real issue. And especially when these are indoors, last significant amount of time and where there's no masking or social distancing. So the fact that businesses are open, I'm sure we are getting some community transmission that way, but most of the cases that we're identifying, again, while there are some that we never can determine the cause, many of them are associated with these other activities. So our message again to the community is we all need to work together. Number one, for the health of our community, especially our vulnerable members. But number two, to keep our businesses open and keeping people working and generating income. We need everyone to contribute. We need everyone to do their part. And so we need businesses and faith communities and others to follow the guidance that's out, that the state's put out. This links on our website, shastaready.org. So we need them to do their part in that regard. And that, one of the main things, again, social distancing in businesses and having employees masked with face coverings. And then we need individuals to do their part. We need to stay home when we're sick. We need to only go out when necessary. We need to not gather in any format, if possible. And we need to wear face coverings when we go out in public around other people, and especially into businesses. So those are some things we can do. It's great that everyone can contribute. Every single person in the community can be part of the solution. And we can all do those things to help our neighbors. because once again, we never know when we may be asymptomatically infected ourselves, and we don't know who else is infected. So we do have widespread community circulation of the virus. We need to take precautions, and I thank everyone for their help and support.
Thank you, Donnell. Anybody else have anything to share before we move on to media questions?
Hey, Carrie, this is Matt. Hi, I'd just like to add to some of the things that Donnell just talked about. And maybe just starting with our Board of Supervisors, who's been engaged, very supportive of all of our efforts here to contain the virus as much as possible here in Shasta County. And, I think over the course of the last few months, we've been really successful. We've got almost all of our businesses open in Shasta County, which is a great thing. We've talked a lot over the past couple of months about what happens when our numbers go up. And as Donnell said, we've had a rise in cases, and we're kind of on an uptick. So we've got the ShastaReady.org website, and you can see on our dashboard that we're in a high risk time right now. So we just want to continue to enforce that everybody needs to take precautions. Everybody just needs to do what they can for the greater good here in the community, so we can keep our businesses open and we can keep our community safe. So that's all I wanted to add this morning. Thanks.
Great, thank you. Anybody else?
Yeah, I just have one more thing to add that Matt reminded me of, and that is that almost all businesses are now allowed to be open. There are very few that are not allowed, but not all businesses have chosen to open. And there are some large corporate-oriented restaurants, stores, movie theaters that have not yet opened. That is not because our guidance does not allow them to, is that they're taking more time to set up their reopenings. So if you see stores, restaurants, movie theaters not open right now, that is not because there's any restriction on them from Shasta County. It's just a corporate decision on their part.
All right, thank you. Anybody else? Okay, I think we are ready for media questions.
Well, good morning, everyone. I've got a couple, I guess, for either Donnell or Dr. Vivakis. Donnell mentioned a couple of the travel and large gatherings. Do we know if there's any cases connected to the protests that we had? Anybody?
Sorry, it looks like Dr. Vivakis was speaking, but it's not working for some reason. Donnell, do you, or?
Yeah, I'm sorry, Dr. Vivakis, we didn't hear your answer, so maybe you can troubleshoot that there. We do not know of any connection to the protests at this point. That's, again, not to say that there wasn't transmission in those settings, but we have not identified that as a cause of any of the cases.
Are you concerned at all, Donnell, about the cases skewing younger? We had the girl, the under 13 or whatever yesterday. It seems like the virus is getting, younger cases now.
Yeah, I think mainly what's happening there is early on, we were, our testing was quite limited, and we were testing almost all high-risk individuals, many who were gravely ill. And so that was skewing more older individuals, since older people are more likely to have severe illness. So now that we have widespread testing, in addition to having more workers back to work who tend to be younger, I think we're picking up a few asymptomatics that way. And I think that there are more people in the community who are infected that we're actually detecting through testing. I think we had some younger people ill before. They did not meet the criteria of serious illness to be tested, so we don't have that. We weren't counting them. So I don't know that the age distribution of actual incidence of disease has changed that much. It's more of a detection bias just because of the difference in testing between now and back in March, April.
Okay, and last one. We are on here now before the governor's news conference today. He talked about tightening restrictions. Any idea what that might be and what that might mean for the county?
There was a call last night. Several staff listened in on, and so I do believe some of the things the governor might say today will be that if a county is on the watch list for several days, I believe it's 3 days or more, that there will be some additional restrictions on places where people gather. So there may be some other venues besides bars. The governor's already announced that bars are not going to be allowed to open or be open in those counties, but I think there's going to be some additional gathering places that will be shut down in counties on the watch list. So Shasta County is not on the watch list at this moment. There are some other North State counties that are, so it may affect those counties, but I believe it's going to be some announcement along those lines.
Thank you very much, Donnell.
Other questions?
You guys obviously mentioned the masks a lot, and of course now it's state law. Apologize if this has been addressed and I missed it because I haven't covered one of these meetings in a couple of weeks, but what does the enforcement of that look like? I mean, it seems kind of like there basically isn't any, it's still just an honor system.
That is true. It is an honor system. We believe we have a lot of honorable people in our community that want to do the right thing. Obviously it's going to be difficult for any agency to go out and enforce mask mandate, on the general population. I think what our main focus would be is working again through business engagement with our businesses, to work with them side by side on how they can best implement those best practices and guidance in their places of employment. And we do prefer if they require masks for people to come into their businesses. Some are doing that, some aren't. But I believe that mask usage has gone up since the governor put out his order, and that's a good thing. It's a simple thing to do. It is not onerous to wear a mask. Again, unless you have some kind of debilitating medical condition, it's not onerous to put on a mask for 20 minutes or half an hour while you're in the grocery store. It's a beautiful thing you can do for your community because, again, your mask protects me, my mask protects you. So it's not that big a deal, and we've learned to wear seatbelts. We've learned to not smoke around other people. I think we can learn to wear a mask for the rest of 2020 when we go out in crowded places, and that's what we're asking people to do.
Did you have other questions, Elena?
No, I mean, other than I was just curious, obviously neither of them is here, but I was just curious. I know in other places I've seen sheriffs or police chiefs saying they won't enforce the law. Do we have any, I imagine there's those conversations here with our sheriff and police chief. Can you share anything about what they've said?
Reading Police Chief did make a public announcement that his department did not have sufficient resources to enforce the mask mandate. So he did make a public statement to that degree. And again, I think that we want to use persuasion. We want people to understand that it's the right thing to do. And I think it's not realistic to think that our limited police resources are going to be spent, monitoring that in stores and such.
All right, anything else, Elena?
Mr. Pontes, is there anything you can share about that as far as the county and the sheriff's office's position?
So, certainly, I know that our sheriff's office, and our police chief in Reading have both, come out and tried to help with the education side of things, throughout the entire COVID. I know that the police chief has been out there in businesses in the city, talking to those business owners and trying to encourage them as well. And I know that we continue to kind of watch the virus and try and understand where to do things. But as Donnell said, they're limited resources, you know, and they're constantly busy. So they're focused on other priorities in the community to keep them safe at this time.
All right, thank you.
Yep.
All right, other questions? Donnie, I see your light is green. I do not hear you. Are you talking? Light off, light on. Okay, she did send me her questions. She's having some audio difficulties, so I will ask them on her behalf. Again, these are Donnie Chamberlain's questions. For the hospitals, are there any staff who have tested positive, and if so, how many? And Mark and Val, you're the hospital peeps today. Oh, Val, we can't hear you. I'm sorry. I'm not sure what's going on with our audio today. There are a couple people that can't be heard. No idea. All right, Mark, do you have any information on that?
Sure. So for Shasta, we have had a couple individuals test positive, like you would expect with the community. But you know, the good thing is with those individuals, they were, you know, outside the hospital, no concern about exposures to other employees or patients or anything of that nature, and they're doing quite well. So yes, but very minimal.
All right, thank you. Actually, she has 3 hospital-related questions. So the next one is, how many ICU beds are currently available? I know that number changes on a fairly regular basis, but do you have current information on that?
Obviously, I can't speak to Mercy, but I believe they have around in the mid-30s. I would say like 37 or so total ICU beds, but I know they can flex to much greater than that. For ourselves, we're about half capacity at this point. So we have a total of 22 beds. We can flex up to about 30, 37 if needed. And we only have a dozen in the ICU at this point. So obviously we're not expecting any major rush of ICU patients, but if we had that need, we have a large ability to flex up.
All right, thank you, Mark.
Can you hear me now?
Yes, I just unmuted you, so yes.
Okay, that's why you had me muted. So as far as the positives, we have had no mayor's staff test positive, and we have been testing all of our staff as well as our skilled nursing residents. In fact, I had my test done today. And the ICU question, we have no ICU beds, so we do have some negative pressure room available, 4 of those, but we have no ICU, and we have had no COVID patients here at Mayor's.
Great, thank you, Val. And then Donnie's last question is also for the hospitals. What is the protocol with regard to testing patients? Anyone who is seen or treated at the hospital, or just pre-op patients?
So definitely the pre-op patients, 100% of those individuals get tested or are close to it. And then for the regular patients in the hospital, they would be anybody who would have a suspicion of any type of respiratory or viral illness. You know, many of those symptoms can be not just respiratory. So while not 100% of the patients get tested for COVID, a significant amount of them do. And it really is up to the infectious disease physicians and the ER physicians to make that call. But they definitely have multi-layer filters to make sure that these patients are safe.
Thank you. Other media questions? Going once, going twice. Okay. If nobody has anything else to add, did anything else come up for anyone on the call? No? All right. then we will thank you again for being here for our weekly call. We'll see you again on next Wednesday at 11 a.m. Everybody have a safe and healthy holiday weekend.
Thank you.